Hi, this is Dr. Anderson, and I'm here with Tim, who we interviewed a little bit earlier, and he's already had surgery on the left leg, and today we're getting ready to do surgery on his right leg, and in the video he talked about how he's probably close to 80% better, right?
Yeah.
Just a few days out. That comes to us from the great state of Pennsylvania. But he's here, and about 2 or 3 days from now he's going to have decompression surgery on his right leg. But what I want to show you is something that we do to evaluate patients' nerve tunnels before surgery. And we can actually see a lot of interesting detail with using ultrasound, much like when you look for a baby and during pregnancy. So what I'm going to show you, we're actually evaluating the superficial perineal nerve, which is in this area. And I use the ultrasound machine to locate where that nerve tunnel is, because unlike a lot of these other nerve tunnels, this one can vary. It could be a little bit higher, a little bit lower in the leg, and we use this to get a good approximation where to make our incisions. So ideally we can make smaller incisions when we open up the nerve tunnel, rather than making a longer one trying to find where the tunnel is. So I use this as a tool for that reason. But one thing that we really noticed, and I like to show this to you, if you can, maybe get in closer, either over here or around the other direction, but right here, let me get your orientation. I'm up above the ankle, and that is nerve. This is the sheath that goes over the nerve, a little bit of fat layer, and then skin, but it's the sheath, which we call fascia, muscle beneath it. Like if you pull your foot up and down a little bit, you can see it kind of moving, that's muscle. But right in there, that's stationary, that's the nerve. And as I come down, I want you to watch. I'm moving this further and further and further down. And that nerve is actually getting wider. It's kind of getting pancaked, I call it. Why? Well, presumably because there's a lot of pressure on the nerve. And as you go down further, it's going to exit from being underneath that sheath and now be on the outside of the sheath. So it can be closer to the skin, because it supplies probably about 3/4 of the sensation at the top of your foot. So see how wide it is? And then when you come back up, it's not quite as wide, it becomes more oval. Now I'm going up towards the knee joint. So, and right in there, it's getting quite a bit rounder. So maybe a little bit hard to see, but that's something I think it's another bit of evidence. There's other ways that we can check clinically to assess these nerves to see if there's compression by some of the neurological testing that we do. But this is just another visual tool that we're using to also demonstrate compression. So just a phenomenon we're learning about here at Anderson Podiatry Center for Neuropathy and Chronic Pain. And if you have any comments or would like to subscribe, I really suggest you consider subscribing. That would help get the word out that we're actually able to help more and more people with restless legs. This is another option that people have, and it's more evidence that what we do really works, not only from our studies that we do, but also from ultrasound. It's showing that what I like to use the term called the restless legs compression syndrome, because I really think compression is a big part of a lot of these patients with restless legs. So thank you for watching.